So, hello everyone. My name is Danit. First of all, thank you for the opportunity to present here today. Here with me is Professor Rachel Nissanholtz-Ganot. She already spoke. We are very happy to present our research in pain medicine in Israel, assessing services, challenges, and strategic solutions. So, chronic pain is one of the most significant challenges in the healthcare system in Israel and around the world. And people who suffer from pain are affected in many aspects of their quality of life, whether it's a loss of income, problems such as anxiety and depression. It causes sleep problems and may lead to drug addiction and even suicide. Chronic pain is common as age increases and is more common among women. Although it's very common among the population and poses a major challenge in the world, there is still a gap of information regarding the needs and the challenges in the field of pain medicine in Israel. So there are two main objectives for our study. First, we wanted to examine the significant challenges that exist in this field, and based on what we found, we want to propose relevant solution to address these challenges. So we used several methods to our study. First, a deep literature review to understand the situation in Israel and around the world in the field of pain medicine. The second one, we had 53 in-depth interviews with key policymakers in leading service providers in the field of pain management, including 8 interviews with opinion leaders from various countries around the world. Also, we had 2 focus groups with patients with chronic pain, and we had online survey among all the pain physician specialists in Israel with the support of the Israeli Pain Association. So here is the quantitative part of the results, and Racheli will show you. You need to unmute. We can hear you.
Yes, ma'am. Please wait.
No, Racheli, we still can hear you.
Can you hear me now?
Yeah.
Okay. So hi, I'm Professor Rachel Nissanholtz and Ganot, and I will present our results. So from the in-depth interview with policymakers and pain care providers, we found several key challenges. First of all, there are no available appointments, meaning patient must wait a long time before seeing a physician and receiving treatment. This issue exists across the country, both in central area and in the periphery. In the area of treatment and use of opioids and medical cannabis, there are significant difficulties. These challenges affect both the providers in terms of delivering such treatments and the patients who often lack proper knowledge about safe and effective usage. Pain care providers express also dissatisfaction with their working condition. There are also many types of pain symptoms and conditions, and there is a major challenge in diagnosing them correctly. And there's also limited access to pain services, and this is a very, very significant issue in Israel. Can you move? Thank you. And regarding the needs, so the primary need was for listening and emotional support. That's the most important need that we've heard from patients. Some of them talked about empathy and the need that someone will believe them. Another need is to make efforts and actions to prevent burnout of the medical staff. And there is expressed the need for longer consultation time during appointments. Okay. The solutions that came up by our interviewees and also from the focus group touched several areas. First of all, strengthening and expanding the services in the community and in the periphery. Also, there should be more clinics with multidisciplinary teams that would treat all the relevant, and that will include all the relevant therapists. And third, expanding the workforce by expanding the professions that treat the pain area and including other professions such as physiotherapists, for example. And the construction of the survey was also based on the finding from the in-depth interviews, and we saw from the patient that the integration of additional profession in pain management, which is one of the most prominent solutions raised in the in-depth interviews, and we asked about both nurse practitioners and physician assistant. It can be seen that more people think that nurse specialist, which is like a nurse practitioner, should be integrated by physician, should be integrated into the system more than physician assistant. In Israel, I can say that we usually accept the nurse practitioners more than physician assistants. In addition, the main need that emerged from the physicians was that better treatment in remote areas and strengthening and improving the community-based services and the need for new technologies in pain treatment. In the focus groups with patients, several important challenges also emerged. The unavailability of appointments, as we showed before, attitude of caregivers towards patients during the medical treatment and during the visit, high cost of pain treatment because many of the people need to buy it off the pocket, and significant difficulty in diagnosing different pain conditions. Please move on. The policy recommendations include expanding the pain care workforce, improving referral systems, enhancing community services, increasing accessibility, and raising awareness of this situation. We're now writing a paper on this study, and we will elaborate there much more than we can do it here. Thank you for listening, and thanks for having us.
Thank you.